get started. So, good morning, everyone. Um, Today we are presenting the health science programs, those that are non-competitive today. So we welcome you and hope that this information is very useful in you being able to make a decision about academic programs or helping you to understand additional health science programs a little better.
Yep. And I'll maintain the chat. So if you've got questions, please put them in the chat and we will answer them. So it's good to know more about our other programs besides for nursing. All right, I'll change the page. All right, so hello, I'm Shelley. I've been here at Wake Tech for going on close to 20 years, and I have only worked health sciences. So please do not ask. I do not know any other programs at Wake Tech, but I can answer health science questions. So ask away. We're going in alphabet. You're next, Devin.
Well, my name's Devin Cummings. I'm one of the advisors for the health science programs, and I've been here for going on 11 years now.
And Beth isn't here, so.
All right, I'll go next. My name is Ryan Batchelor. I've been at Wake Tech for going on 15 years now. I've been at health science for about 4. One of the advisors, and happy to have you all here today.
Awesome. And my name is Toy. I've been here for the least number of years, probably about 3 at this point, maybe 4. And I'm one of the admissions and academic advisors at the health science campus.
Yay, thank you. All right. I guess we can just take turns. I'll start with what health science programs are offered at Wake Tech. And I think one thing that a lot of times students will get confused about is they're interested in health sciences as a career path. So they want to be a doctor, they want to be a chiropractor, they want to be an optometrist, and they still come to health sciences. But specifically, we for health sciences, admissions, and advising work specifically with the health science programs that Wake Tech offers. So it is the Associate of Applied Science degrees, diplomas, or certificates. And we have what's called competitive and non-competitive. Competitive programs are programs that are going to require students to take classes ahead of time, earn points, and we can't guarantee acceptance. Non-competitive is going to be our programs that don't always fill up. It's not point-based. So there's some different criteria. Our non-competitive programs include the electro-neurodiagnostic technology. We're just referred to that as EDT. That is mapping brain waves and sleep patterns. We have our EMS paramedic program. We have medical assisting, medical lab tech, pharm tech, phlebotomy, therapeutic massage, surgical tech, nurse aid. Those are also offered at Wake Tech, but they're going to go through our workforce continuing education programs. So we have it. We know enough about it to send you to workforce continuing ed, but they are here at Wake Tech. And then you can see our competitive programs, assisting hygiene, so all those other fun ones. Did I miss any programs? PN. We now have practical nursing, and we don't have it on the sheet, but that's under competitive. Anyone else I met? Oh, wait, okay, we've got mammography. Any other new ones I missed, guys? Okay. Any questions on programs? Next slide.
All right, so you learned yesterday, or not yesterday, why am I confusing days? The other day about competitive programs if you joined us. Those competitive programs include the nursing programs, so that would include our ADN, our LPN to RN program, our new practical nursing program. Then we have both dental programs, dental assisting, dental hygiene, and the imaging programs, which would include all of them, radiography, medical sonography. Am I missing? No, I'm not missing. And then you have the advanced modalities, which are MRI, mammography, and CT. So for students who are interested in competitive programs, since our audience are other advisors, it's kind of easy to suggest that when a student does come to your campus and they remark that they're interested in one of these particular programs and they have not completed the information session, you first want to lead them there before suggesting that they come for an advising appointment, because there's so much information in an information session that we can't cover in a 30 to 40-minute advising session. So we like them to have the background knowledge of the basic admissions criteria. That way we can spend the advising appointment really talking about what courses they need specifically to be a competitive applicant in creating that course plan. And all those information sessions can be found on our health sciences information session page, which is hsinfosession.waketech.edu.
Yep. And the nice thing about the information sessions, I know students don't like to do it, but they're online, and students think they've got to be at a certain, they're 24/7. But just with all the additional requirements for the competitive programs, who requires a nurse aide, who requires the TOEFL, who requires the T's, who gives points for educate, the programs all have so many different requirements. We don't want any students to be coming in and missing key components so they can't apply for the program. So if they can, info sessions are good. All right. Next, someone? Ryan?
Yes, I can go, but I'm still, the slides, if you're moving them, they're not moving on my end. I'm still on slide 1 is what it's showing. So I'm not sure what slide I'm supposed to be
on.
Go
to number 5.
Not moving.
All right, but you're seeing it, Toy?
I am. I'm not sure. Go to number 5, Ryan.
I'm there now. Should be on how does admissions to a health science program work?
Yes.
Alrighty. I mean, the main thing, since we're speaking mainly to advisors, the main thing that you guys, that I could share with you to take away from this is, the more of the gen eds that the students have completed for any one of the health science programs, the better off they are going to be when they enter the clinical portion of any one of these programs. But our non-competitive do not require students to have as many of the classes done, and they're not earning points in the same way for the completion of those classes like they are for the competitive admissions. So a lot of times you'll hear us refer to those courses for the non-competitive programs as priority courses, meaning it is important for them to get those done, in many instances before applying to go into the clinical portion of the program. Because just like those of you that sat through the session the other day for our competitive programs, a lot of students are not simply thinking about the structure or the logistics of the clinical schedule itself. So regardless of whether it's a competitive program or not, even something like medical assisting that's not quote unquote competitive, once students get into the med courses, the actual MED curriculum, it's going to be a more full-time, daytime, much more structured curriculum that the students have a lot less control over. So again, the more of the gen eds, the English, the math, the bio, the psychology, whatever gen eds are required for the particular degree program, the more of those that a student can have completed before they apply to go into the clinical portion of the program, the better it is for the student in way of, in terms of their success. There's clinical application deadlines for all of our non-competitive programs, similar to the ones that we have for the competitive programs. But as Shelley said, oftentimes our non-competitive programs do not fill. So that means that sometimes those deadlines we have a little more flexibility with.
And we lost Ryan.
Shelley, unmute.
You can't hear me?
Oh, we can hear you now.
All right, I'm not sure where I cut off at. I was just saying that there's clinical application deadlines for the non-competitive programs the same way that there are for the competitive programs, but the deadlines, we stick to them for the competitive because there's way too many applicants. We have to stick to those. But the deadlines for our non-competitive programs, if we still have space in those programs, we will allow students to apply and submit those applications well after that deadline, so long as we have space in those. So I know that's a lot of information I just gave out. Anybody else want to throw anything in?
Can you hear? Am I okay? You can hear me?
Yes.
Okay. One thing that I will say, and I don't know, there's just so many new advisors nowadays. Back in the day, we required for health sciences that students had to have all transcripts to be accepted, we do not require that anymore. We just follow the basic Wake Tech transcript requirements. If they've got a 2-year degree, a 4-year degree, we do not have to have high school. So I think that's one change that we made about 2 or 3 years ago, that still is having issues kind of getting out of the process, because so many people are used to saying that for health sciences you have to have all your transcripts. So that has changed. The other thing with health sciences, and again, this is one thing to be wary about, is of course those time limits. And some programs have time limits on math, some don't. So if you're speaking with a student, you might always, if it's health sciences, go, and I know a lot of people will send them to us, but you do want to check to make sure that there's not that time window. They might need math, they might not. Did you have something, Toy?
No, my computer's acting very strange, so I had to go with my hotspot. Not that everybody needed to know that, but I'm good.
So any questions about, just health sciences, do the Wake Tech application, transcripts, and see us. All right. So Sam's going to ask a question here, I think. Oh, the time limits for math classes. Primarily, it is 10 years. So now some programs don't have a math requirement, like Farm Tech. There's going to be a new program planning guide. They won't require math. But each program is just dental assisting. So yeah, always check with us. Devin, you want to hit what are limited enrollment programs?
Sure, I can do that. So some of the programs that are offered at Wake Tech, primarily all the health sciences, have a limited number of seats once you get into the what we consider the clinical portion of that, so the actual major classes. So in the case of medical lab tech, those medical lab tech classes. For the limited enrollment programs, they do have unique admissions requirements, and each one's a little bit different. Basically, you just have to meet the minimum admissions requirements. In general, that's going to be English, math, sometimes a chemistry or biology, depending upon the program. And then from there, you would submit the clinical application or program application to get into those actual major courses. The programs that don't necessarily have limits to them, the human services, the health and fitness science, EMS is going away from that. They're trying to offer more availability. So it's going to be one of the more open programs with less limits to it. And then pharmacy tech is kind of there, though they do have a limited number of seats. They tend not to fill those seats. So it is one that students can apply later through the process and still be accepted into the clinical portion.
All right, yep. Any questions on the reason? And I know other programs at Wake Tech have limited enrollment because there's just so many students that you can accept. I think it used to be culinary, automotive. Like I said, I don't know much about other programs, but the only reason our programs are limited is because of accreditation. We can only have so many students with so many instructors with so many hospital affiliations. So we would take everyone if we could, but we cannot. So priority admission, Toy, that's medical assisting. You want to talk about that?
Sure. So we have 2 priority admissions programs. One is medical assisting, and the other is medical laboratory technology. And what happens is the admissions to those programs is a 2-step process. You are first admitted to Wake Tech to be able to take specific prerequisite courses or program admissions courses like your English, like your biology, like your math requirement. In some cases for MLT, you also have psychology. a computer course, a second English, and I think that's, oh, in a humanities course. But anyway, you are admitted to Wake Tech, then you are advised to take those specific courses. And then at the point in which you are eligible to apply, those students who apply that have the earliest clinical application submission and have the highest number of those courses complete at the time of application are then selected by priority to the program. So an example of that for medical assisting, because it's one of the programs that I review for, is that we take about maybe 32 to 36 students twice a year, but we always have more applicants than students that we can select. So what I do is I look at all of the applicants and I first choose from those students who had the highest number of general education courses complete at the time of application. So those who have 3 courses complete are essentially a shoo-in, and that's English, bio, and math. Those who may have 2 are really good candidates as well. And typically, if I can fill all of my seats by students who have 2 or 3 courses finished, then I don't typically make it to students who may only have English done or just bio done or just math complete. And there's a specific reason for that. It's because when you are accepted to these programs, you typically are a full-time health sciences student. So having the pressure of needing to complete all of those gen eds in addition to those curriculum courses or program courses gets a bit overwhelming for students. And so we realize that students work and go to school and may have personal responsibilities as well. So it's always best when we're advising to really hone in on what are your major responsibilities, how does school fit in, and that really dictates how your program admissions should work, at what point in time you should apply to a priority admissions program. And Devin also advises, or his responsibility is MLT. Do you want to add to that, Devin?
Sure. I do the ranking for those clinical applicants pretty much the exact same way Toy does for the medical assisting. We find that students that have gone through and completed those gen eds are able to focus much better on the major courses and then be more successful. With the medical lab tech program, it's a fairly strenuous kind of chemistry-based curriculum. So it's much better when students can concentrate just on those major courses and not have to worry about those gen eds. So we've seen a kind of higher rate of success with those students having those gen eds done. Much fewer folks exiting for various reasons, whether it be academic or time constraints, things like that.
And just confirm for me, Devin, medical lab tech usually gets about, 80 applications? The program starts one time a year in the fall, and we accept 24 students. Is that correct?
Yes, that's correct.
Okay.
And typically, there are 7 general ed courses that we look at for the priority. Each one of those awards 1 priority point, with the exception of the anatomy and physiology, that awards 2. Typically, the kind of points range that students are looking at is 6 and higher to be competitive to get one of those seats.
Yep. And then one thing with the health science programs, and this was with all of them, they're considered a cohort program. So once a student is accepted to the program, they're not pre anymore. They are medical lab tech or medical assisting. They have to follow that program planning guide. So I think I'd have to pull up medical lab tech just to see. But like that first semester is, let me pull up the degree. So in that first semester for medical lab tech, there is a total of 5 classes that students have to take. So MLT 110, 118, 140, 111, and 115. And students have to take all of those classes in that semester, pass with a C or better, to move to the next semester. So it's not, they can't pick and choose and take 4 years. They start and they need to finish. We want to get them graduated. What programs allow students the ability to work or go part-time? Katie, that's only going to be health and fitness science and human services. That's it. Every other anybody else, no other health science program allows them to go part-time. Am I missing one? Have I lost my mind? No one's coming off mute, so that must be right.
No, that is correct. And that's exactly why I put that emphasis on the students needing to have as many of those gen eds done before they go into any one of those programs, because the likelihood that they can handle a schedule like what you just said, Shelley, with English and psych and math or whatever on top of those 5 classes just is not going to be conducive for majority of students out there.
Yeah, and then students have to also get into the hospital setting. So once they start that clinic I'm still on MLT's program planning guide. For the summer, it's 12 hours a week. For that next fall is 18 hours a week, and that's on top of taking their other courses. And by the 4th semester, it's again 18 hours a week that they have to be in a lab. And Toy posted an example of the program planning guide.
Just a snapshot of the first semester so students could see how intense it is. So if you were admitted to a program and still needed bio or English, where would you find time to do the English paper or anatomy and physiology on top of all the MLT courses that you would have to take? So it really is about balance, and you never really want to be overwhelmed with school that you feel it's unachievable. So to me, it's always important to kind of really target those basic courses first before engaging with any program, especially if you have to have a part-time job and still go to school as well. That's balancing multiple things, and sometimes we aren't always the best jugglers, me included.
Oh yeah, when I used to do the dental hygiene information session, I would tell students all of a sudden now you've got to, I can memorize stuff. I can read a book, I can memorize it, I can take a test, I can pass it. But now all of a sudden you want me to apply it. And not only am I applying it in front of my teacher and my fellow students, I'm applying it in front of a patient, in front of a complete stranger who I've never met. And so now all of a sudden I've got to do an IV, I've got to draw blood, I've got, so it can be stressful. And so as little additional stress as possible for the students so that they can be successful in the program. So it's just a different way of doing those classes. It's not just sitting there memorizing the material. All right. No other questions. First come, first serve. So medical assisting and medical lab tech are going to be our priority. So we're looking because we've got enough students that are in, but we're not making it competitive. We don't care what the grades are, as long as it's an A, B, or C. The rest of our program, EDT, EMS, Farm Tech, all of that is first come, first served as to when you submit that program application. All program applications are online. It is on our webpage. They are electronic. Students can download them to their computers, fill them out, and send them right back to us at our email. And so what we do is we date when we receive them. We keep them on a little Excel report. And then students will receive emails about attending a mandatory departmental orientation. Any questions on that? Thank you, Devin. Our one student asked for a link to the form. So yes, so just send that to us as soon as possible. We're going to make sure that you've met all the basic admissions. You'll go to the orientation and phlebotomy. So phlebotomy probably gets around 70 or 80 applications. We take 18. We accept ask everyone to come to the orientation. We look to see who shows up. The first 18 people who submitted the application would then be accepted. That group of students are the ones that can then take the phlebotomy courses. Any questions on the first come, first serve? Any input from Ryan or Devin or Toy? All right.
With the first come, first serve, the big thing that I recommend is if a student has those minimums met even if they're taking a couple of the gen eds, go ahead and submit that program application. The earlier you get it in, the better your chances of getting in. If you wait and submit it just before the deadline, your chances of getting in are very low.
Yep. And we don't have any application window except for hygiene, but that's a competitive program that we talked about on Monday. But all the rest of the programs, there is no specific application window. They can submit that at any time. Got something, Toy?
I don't.
Oh, and see, you got the next page. There you go.
Cool.
Application deadlines to Toy.
Happy to do it. All right, so we have application deadlines for all of our programs, and these are not necessarily specific to applying to Wake Tech. They're applying to the program. So for dental assisting, which is a competitive program, all applications have to be in by May 15th. And it's for fall entry only. For dental hygiene, we have an application period. So that actually needs to be updated on the screen. But the application period for this year started April 1 and it ends January 31st. And what's very unique about dental hygiene is that the earliest the application is submitted with the student with the highest points are those students who will be selected for the program. So that can be unpacked, but since we're not doing competitive, I won't go into detail. Then our EDT program only admits for the fall, and the deadline is May 15th. EMS, we're technically submitting applications or off, we'll take the applications all year long. It just means that the deadline for submitting is May 15th, but there's more flexibility now for EMS. So I would certainly, if you're considering paramedic, please schedule an appointment to really go over what your options are, because what we may do is refer you actually to the department to get more information about all the options that are available to become either a EMT or a paramedic. Lots of different options. And then we have LPN to RN that only starts in the summer. So the deadline for that is January 31st. Medical assisting, we admit twice a year. And I am not absolutely firm on these deadlines. I will take an application whenever. Okay. So for this particular program, it's great. It's 1 year. We have diploma and we have associate's degree option. Diploma is a 1-year program. There's excellent job demand in the area. So if you know of students or if you're in a situation where you're looking for some job change, this is a perfect program. Sorry for the commercial, but it's my program. So the deadline for spring entry is September 15th. But again, I will accept as long as we have seats still available. I will still take applications because I realize we do still admit students through winter, sort of like our winter break. And then for our fall admits, May 15th is the deadline. But again, if I still have seats available, I will still accept programs. And typically that does happen. MLT, fall entry only, deadline is May 15th, but the earlier you submit the application, the better. Devin explained that reason, the reason why. Nursing, radiography, sonography, we do spring and fall entry. So for spring, it is July 31st of every year, and for fall, January 31st. So we're approaching a fall deadline. Farm tech, fall entry only, but that is changing. So you definitely meet with an advisor so that we can go over with you your options. We're being a little more flexible in farm tech, but originally it was fall entry only. May 15th was the deadline. Phlebotomy, spring and fall entry. Indeed, the earlier you submit your application, the better your chances, because we definitely have way more applicants than seats available for phlebotomy. And that would be September 15th and May 15th. And then finally, for practical nursing, which is one of the newer programs that we offer, spring entry only, and September 1st was the deadline. So students would be targeting that for next year at this point. So lots of different options.
Yeah, and definitely for our under-enrolled program, that would be EMS, farm tech, EDT. Definitely we will accept applications. I think for farm tech, classes started August 16th, and we were putting people in August 17th and 18th. So always send in that application, and if there are spots available, we want to get them accepted and into the program. Katie wants to know, should we Do we suggest that we refer students directly to the advisors who handle the programs? Any input on that from the advisors? I mean, any of us can see any of the programs. So I would hate for, a student who wanted information, for medical lab tech, and Devin's on vacation for a week and then they don't get a response.
Yeah, anyone you can send them to anyone. They're all in good hands, honestly. We all come from a point of being well informed, and if it's a question that we're unable to answer, we go to Shelley.
Yeah.
And if Shelley's not available, then we certainly can refer the student to submit an email, or we'll send an email on behalf of the student to that particular advisor. But there really isn't too much that we all don't know.
Yep. And you can always send them to that HS advising email, because Andrew and myself will answer those. And so, a lot of times we can get some of those basic questions, and we know then specifically if they're like, oh, I want to get into medical assisting, are there spots? We can send them directly to TOY or the advisors who are ranking that program, and they know how many applications they've received. So, yeah. All right, Ryan, you're up next. What is the slide you get? Oh, there you go.
And before I go on that slide, one quick thing I wanted to mention about the additional modalities for our imaging programs, which are CT, MRI, and mammography. Just so you guys know, those programs are not programs that students can pursue unless they have already completed the radiography degree and they hold an ARRT certification. One of the only other programs that I know of that would allow a student to have an ARRT certification outside of radiography would be a degree in nuclear medicine from the 4-year level. So just when you're talking to students, a lot of times students come in and they want to pursue CT or MRI or mammography because they see that it's a very quick certificate, and they're like, oh, I can get that done really quick. A lot of them, excuse me, are not aware that they do have to have that prior education before they're able to pursue those. And for that reason, just so you know, a lot of the students that fill our MRI, CT, and mammography students are actually internal rad students that are ours that are, making the decision to join that cohort right before they're getting ready to graduate from radiography. We do have a small number that come in, quote unquote, off the street, but just so you know, a lot of those are our students that fill those programs as well. All right, so speaking about the program planning guide and advising, kind of goes back to what we've, gone over a number of times in a number of different ways. The way that the program planning guide is just that piece of paper that we have to publish, to show exactly which classes you're going to take, the number of credit hours you're going to earn in order to earn a certain degree. But that's not the way that any of the health science ones are administered. It's very, very rare that you're going to see a student move through the PPG actually taking all of those courses clustered together the way that they're listed on the PPG. So that's why you see those farm courses circled, by themselves. Because again, like Shelley was saying, by the time the student enters that clinical curriculum, there is no flexibility whatsoever. They can't say, oh, well, Farm 110 and 111, those work great for my schedule, but I need to put Farm 115 off for next semester. That conflicts with my work hours. Well, then you don't get to do the program. There is no, you either can do it or you can't. So, one thing that we really try to get students to understand with the PPGs is that that's just listing literally the classes that you're going to take, the number of credit hours you're going to earn to be awarded that particular degree, but that is not how it's going to actually be administered or how it's going to work, if that makes sense.
Yes, it does. And I will add in, because I'm a little nerd here. When students are looking at the PPG, a lot of times folks will look at the credit hours and they will assume that's how many hours they're going to be in class. But you've also got to look at the lab and clinical hours, because for every 3 hours of lab, it's only 1 credit hour. So even though it's 14 credit hours for that first semester, students are actually on campus 17 hours a week. Same thing with that first spring semester. It might be 13 credit hours, but oh no, now we got big numbers here. What's that, 9, 17, 22? They're 22 hours a week on campus. That's a big difference from 13 when they're trying to calculate in how much time they can work, and working full time is a little difficult because we've got to get you into that pharmacy. So any questions on the PPGs or any other input on PPGs? Okay. Devin, you want to talk about the next one?
Yeah. So the English and the bio classes on a previous slide, if you notice, those were highlighted. You can take those ahead of time, and we strongly encourage students to do that so it lessens those hours, like Shelley was saying. But the actual major courses, MLT, EDT, medical assisting, phlebotomy, those are ones that you have to be admitted into to be able to take. So that's where that program application comes in. The programs have limited number of seats available. For instance, medical lab tech is 24, phlebotomy is only 18. So quite popular programs that only admit a very small number of students into those actual major classes. Probably the biggest thing is that when you're going through to complete these, you'll see that an associate's degree is a quote unquote 2-year degree. It may actually take you a little bit longer than that. Medical lab tech students, it usually takes about a year to go through and complete those general education courses and then apply to get into the actual medical lab tech classes. And then the schedule is set. It's 5 semesters. So it ends up being a 3-year program to go through and complete that full time. And each program's a little different.
Right. The same can be said for like the diplomas as well, is that the diplomas are 1 year in length, but if you're new to college and you haven't completed an English, a math, or any of the other courses, it takes a semester or 2 to get those done. And then once you're admitted to the program, it's 1 year in length. So in total, you could potentially be at Wake Tech for a year and a half, maybe 2 years.
You want to hit the next one? Oh.
Sure. So can I be in progress with required prerequisites when I apply? The answer to that is yes. When you submit the application, you can be in courses, but obviously if you're taking courses past the application deadline, those courses aren't necessarily considered for the priority admissions programs like medical assisting and MLT. Now, MLT is very matter of fact in sort of like their point counts because they always get an abundance of applicants. For medical assisting, if you are in progress with courses or enrolled in courses after the deadline, and let's say that it appears that you're going to pass those courses, I'd still typically invite those students to the orientation. Because again, we don't necessarily always fill our seats. So I try to be a little more accommodating. So here's an example. We have a deadline that was September 15th, but we have students in 16-week courses for this fall semester. I'm still going to invite those students who may only have one general education course complete, but potentially they may have 2 or 3 complete by the end of the semester, because they still would be very good candidates for starting the program in the spring, which would be January. So I don't want to necessarily not offer them the opportunity to be considered just because they're enrolled in a course that was not finished at the time of application. I have that flexibility. MLT, not necessarily, because MLT gets a large number of applicants and they do convert into accepted students, where my students kind of are a little fluid, is a nice way to say.
I think we covered this one on the full time. I'm gonna skip this slide. Does anyone have any? Nope, no problems. We covered this. I think we've got this one in here, Toy, just for medical assisting, because it is a lot of hours for medical assisting. But again, you can see, so students who are accepted into the medical assisting program, that first semester is Med 110, 121, 130, 138. There's also a Med 118 they can take. And medical assisting is one of our programs I think maybe gives students a false sense of this is an online program, because that first semester they have hybrid courses, so they're really on campus only 2 days a week. And then the next semester they've got more classes online, and then by the third semester they're in a doctor's office 20 hours a week. So it kind of increases in
Right.
intensity for that medical assisting program.
Right. And another good point to mention while we have our colleagues on is that we do allow for some of the students who have taken medical office courses to use those courses toward medical assisting. So oftentimes we do see students hop from medical assisting to medical office or medical office to medical assisting. Medical office is way more flexible than medical assisting, since most of those courses, if not all of them, are done online. Medical assisting is really a hybrid model where we have a lot of hybrid courses, but students are still required to do clinical practicum and office administration, which requires them to physically be on campus to demonstrate very specific competencies and tasks to be able to move forward in their program. And that's learning venipuncture, urinalysis, being able to do your basic medical entry, like your weight, height, blood pressure, and those things, even though they can be taught online, you don't necessarily want to demonstrate those skills online so that when you go into the office, you'll be well prepared to do it on a patient.
Yeah, and I will add, eons ago when I used to work on main campus, Dallas Foster had medical office and I had medical assisting. And the main question we would ask if students weren't sure which one they wanted to do was who wanted to draw blood. And if they didn't want to draw blood, then it was medical office. So that would be the route they would go. And students do have to practice on each other. So we do kind of have to forewarn students, guess what? You will have to practice drawing blood on each other. So be willing to do that. So that was how we kind of split those two up. So if you don't want to see blood, I honestly, the only programs that we have that you would not see blood, hopefully not therapeutic massage. Hopefully you won't see blood there. Um, Hopefully human services, hopefully. Health and fitness science, you never know if you scrape your knee or something along the way, but most of our programs are going to have some blood associated with it. EMS, you have to give each other IVs, so you do have to practice on each other. Anything else with blood, guys? Everyone's like, oh, Shelly went on a weird tangent there. We don't know where she went. All right, how many applications do we receive and how many students do you accept? So, Devin, you've got electro here, electroneurodiagnostic technology.
With the EDT program, right now we're pretty much accepting all the applications that we receive. I believe the maximum number of students that we can take for that is 24. But right now, I believe we have it kind of set at about 14. The EMS program, they're being a little bit more flexible. In theory, they can accept 30 students, but they have several different tracks that you can go. And so they're being a little bit more flexible with that, and they will be able to accept more students. And then I'm going to jump ahead to medical lab tech. Typically for that program, I'll receive, between, I would say on the low end, 40 applications, on the high end, 65, 70 applications, and we accept 24 students. The pharmacy tech program, they're trying to be a little bit more flexible with that as well. Pretty much right now, if you apply and you've met the requirements, we can get you seated for that. Phlebotomy, that program is one of the ones that we receive quite a few applications, but for some reason, not a lot of folks show up to orientation. So it's not uncommon to get 80 applications. We accept 18 students, but by the time we get to orientation, we may only have 30 or 40 students show up to orientation. So it's one of those that you can apply late and still technically be eligible to get in, but we can never say exactly when the cutoff would be to get that application in and be very competitive.
Oh, and I will, just because Devin was talking about phlebotomy, the reason why we get a lot of applications is it is just a certificate, but it is not covered by financial aid. So if students are interested in that program, that is a program they do have to pay for out of pocket.
One of the kind of caveats to that, if you are a veteran or dependent of a veteran, the VA sometimes supports that depending upon the benefits that you're receiving. So if you're a VA recipient, then check with them. They may be able to pay for that.
All right, and for medical assisting, we accept, again, about 32 to 36. And then we receive, right now, I only have about maybe 35, 40 applications for the spring. So the chances of getting in are very good for most of the applicants, depending upon GPA and how many courses they've completed. On the higher end, sometimes I can have maybe about 60 or 70 applications. So again, I'm constantly accepting applications. Like even now, past the deadline, I'm going through student records just to see if anyone's eligible that's coded as medical assisting, so that I can get them to submit the application and get them in the orientation. So yeah.
And it's about 10:50, so we covered the competitive programs already Monday, so I'm going to skip to the next slide just to see what we have. Do you accept letters of reference? No, we do not. And do we have a wait list? No, because what happens with the program applications is if a student has applied and they've gotten in, that's wonderful. If they have not been accepted, those program applications go away. We don't roll those over. So a student would have to submit another program application for another cycle if they are interested in applying. Because honestly, students could have gone to another school, they could have changed majors. So we don't assume that they want to continue to come to Wake Tech and they might not be interested in our programs anymore. I don't know if this is in a slide. Let me know it's not. Hold on. But real quick, I do want to bring up, if students are accepted in any of our health science programs, one thing to let them know is they have to meet clinical requirements. Well, what are clinical requirements? This is requirements that the hospitals and the doctor's offices require for our students to go into their facilities. That means all students who are interested in coming into our programs will have to have health insurance. They will have to have the COVID vaccine. They will have to have the flu vaccine. They will have to do drug testing. They will have to do criminal background checks. They purchase scrubs. They might have to purchase instruments, stethoscope, blood pressure cuff. Dental hygiene is probably one of the most expensive of the programs. So that's a lot of money they have to put out ahead of time. If they don't pass the criminal background check, if they do not pass the drug test, if they do not have the COVID vaccine, the hospitals will not let them come on campus. If they can't come on campus, they obviously cannot do the clinical. If they can't do the clinical, they obviously can't pass the program. So therefore, they are not accepted into the program if they cannot pass those clinical requirements. Any questions on clinical requirements? Does anyone have any input on clinical requirements?
No input. No? I mean, the main thing is that, you just, unfortunately, well, not unfortunately, but these programs are very practical in nature. And so that clinical experience or practical experience makes you eligible to be able to graduate. You have to complete a certain number of hours, so it's not necessarily a Wake Tech requirement. It's a directive from these healthcare facilities. And so that directive is not a decision we're making, but it's a decision that we have to enforce to be able to have students eligible to complete their programs. And unfortunately, you can't do a whole program like this online and expect to be able to make it to the end and then graduate and take your certification or your boards and be able to pass, when a lot of the boards do require practical experience as well as a demonstration of your skills. And so that's what makes these programs very unique, is that there's hands-on experience and not this completely online aspect of learning how to do a job.
Yeah, and Natalia asked, is it online? Yes, it is. So we have a link for the clinical requirements online. We've had issues before where criminal background checks have to be done while even every year. And we've had students in some of our programs, they have done things they probably shouldn't have. The criminal background check was run. Wake Med said, nope, so sorry, you cannot come on campus. And they had to leave the program. So that is just one thing for students to keep in their mind. And of course, right now with the COVID vaccine, we have students who aren't going to get it. Wake Med, I think it was in the news as of September 21st, September 17th, all employees had to have the COVID vaccine, including all students who are coming on campus. So we have students that won't be able to complete the programs because they didn't have those vaccines. So, but it is right online. You can send students to that. All right.
And I will say, one of the questions that I get asked occasionally, speeding tickets, things like that, they don't necessarily, make you ineligible to go to the clinical sites. They're looking for other things like drug offenses, drunk driving, that kind of thing. I had a student that was very concerned that she wouldn't get into nursing because she got caught hunting without a plug in her shotgun. That did not affect her getting in. So even other odd kind of charges, they're looking for stuff that's more focused on the clinical side.
Yeah, and we don't know what keeps students in and out. We are not privy to that information unless the students share it with us. And normally we're like, no, 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 we do not need to know. All right. Ryan, you want to hit the suggestion slide? Because I've been talking a lot. I'm even tired of hearing myself talk.
Sure thing. Main thing is just the students need to schedule appointments with us. Whether they think they want competitive, which is 99% of the people that walk through the door want to be a nurse until they figure out what that's going to entail. And then sometimes they continue on that path, sometimes they don't. Lots of other great programs that aren't as competitive that can get the students in the workforce pretty quickly, with decent jobs, earning decent wages. So, oftentimes I like to tell students, they don't automatically have to go for their biggest goal right off the jump. They can kind of use some of our non-competitive programs as stepping stones to get themselves into the workforce in the health science career field. And, oftentimes that gives them, a little bit more stability in their life that can make them a little bit more successful when pursuing something like nursing. So main thing is just get them in with us. This is what we're here for. We're very passionate about getting them, where they need to be, where they want to be. We're all very good at having difficult conversations with these students and kind of telling them what they need to hear versus what they want to hear. We do that all day long, every day. So again, I just can't stress enough, get them over to us. The virtual appointments, we're all available for virtual appointments. We all take turns on campus. Um, and again, until that student can kind of get in with us and us get a better understanding of their actual academic situation, what are your classes that you have done? What are your grades versus what do you really have going on in your personal life? I can't speak for all the other advisors, but that's when I really and truly can encourage them with the best advice I can give them as to what's really realistic. We absolutely, Katie, always encourage them to meet requirements at other schools as well, so that they're meeting requirements at multiple institutions. The only tricky part with that is obviously we are unable to assist them, in advising them. Oftentimes they'll say, well, what do I need to do to meet the requirements at Central Carolina too? They're going to have to obviously go through that institution, and jump through their hoops in order to meet their requirements as well. But definitely, definitely well worth it for the students for sure. Unsure of their majors sometimes. We're not here to help them pick their programs, we can certainly give our advice as far as rigor and expectation and how realistic their goal is or is not. If anything's ever out of our hands or the student really is lost and they really do need some career counseling, then obviously we refer them over to Laura Bethay and her group, so they can figure out, their strengths, their weaknesses, what they really want to do, what they might be good at, what they might hate, all those good things. So, we're here for all the health science students. Just get them over to us and we'll get them exactly where they need to be.
Yep. And I've talked to Laura before. She even has a specific health track. So, I mean, maybe it's not, you don't want hands-on, but you want to be more in the office setting. There's Wake Tech, y'all know. Wake Tech offers 90, 100, all the programs, and there are so many different avenues that a student can get to where they want to go. A fun one that I've got for the nursing program next week is there are paramedic to RN programs. We don't have one, but other colleges do. So lots of different ways for students to get around. Devin, you want to cover what workforce continuing ed?
Sure. There are several different health programs that fall under the workforce continuing ed. Therapeutic massage was one of the ones that it used to be under curriculum, and now it's moved under workforce continuing ed to kind of better serve students. We've got nurse aid, EKG, central sterile processing, medication aid. We don't advise for those programs. Oh, and surgical tech, like Shelley said there. We don't necessarily advise for those programs. We refer them to Grace and Halstead. But there's plenty of information online as well. Those programs are typically certificate only, and they're going to be a little bit shorter in length compared to the diplomas or the associate's degrees, though they vary a little bit. 3 to 4 months, I would say, is kind of the average for the nurse aid, but again, every program's a little bit different.
All right. Any questions? And Toy's going to tell you about the whatever this thing is, that QR little.
So we want to thank you for joining us today. If you have additional questions, please type them in the chat. We, again, are Health Sciences Admissions and Advising. We are located at the Health Sciences campus, which is 2901 Holston Lane, Building A, Room 102, where we have advising, sort of like a one-stop shop, advising and financial aid all in one place. We welcome virtual appointments. We're all available virtually. We do walk-in appointments as well if the virtual platform is not your thing. But we do thank you for joining us. There is a QR code that's on the screen. We welcome attendees, student attendees, to complete our feedback and also enter to win a gift card. So I also plug that in the chat box as well.